if you're not lined up with that so-called surgery practice where you got residents to help you close and you got the whole rotation going, that's not the way to practice anymore for most people. You got to find other solutions to keep the chains moving. And I've been fortunate when I've talked to my guests that I have on my podcast, and the Biomechanics Summit that I'm going to be doing my third one, where I've been able to get some high caliber speakers. That you get a little bit of something from everybody. You'll get a tip, something that'll change how you look at that patient in front of you.
The one thing I've noticed with yourself, talking to you, and we spoke prior to doing the recording on the podcast, and other people that are in podiatry, or say are involved in sports podiatry, is you can tell they're eager to learn more. No matter what they know now, their mind is so open to, I want to learn more. I know there's other things that I don't know, and they're really eager to find out. They're very open to admitting, I don't know everything and I want to learn more. Whereas I've seen other people who have been in podiatry, whether it's 5 years, 20 years, where it's like, I know enough, and they close their mind off and go, I don't need to know anything else. And I think it's really interesting to just keep your mind open and understanding that I don't know it all. In fact, there's so much more I need to know. And the more you keep learning, the better you're going to get.
Absolutely. I mean, I can give you so many examples of things just even in the last few months. And sometimes what happens too with me, Tyson, is I'll listen to one of my own podcasts, because sometimes the information is so layered. You have to kind of go through it sequentially to really glom onto it. And well, this is just a little thing that I was doing with neurogenic function. Richard Blake, in his book, his wonderful biomechanics, I guess he's on his third book that he's of a series, practical biomechanics for the podiatrist. He was talking about neural flossing. I'd never heard of neural flossing. It makes sense, you kind of stretch, extend out, the legs, and stretch the nerves out, and reciprocal inhibition, and a lot of different things. And I thought that's great. That's yet another tool that I can add. So if somebody has an neuroma, you're not just thinking, Morton's pad, spread the toes out, things that were, that are very popular and talked about right now, but thinking more in terms of the entire kinetic chain.
Yeah, and that's why I think it's important to, and just because somebody, say, may write a book or may have a PhD or does a presentation, doesn't necessarily mean what they're saying is accurate all the time.
That is true too.
Because you can read something and listen to someone talk, and you might go, that may work great in a university setting.